Good morning. From the Department of Oral Medicine and Radiology, tongue, the mirror of your body. A healthy tongue should appear pink or light red in color, should have a smooth and even surface, no visible swelling or bumps should be present, should be moist and slightly glossy appearance, even distribution of papilla should be present, no pain, discomfort, unusual or foul odor should be present. White coating or white patches, yellow coating, bad breath, persistent redness, pain and swelling, small and painful ulcers are symptoms of an unhealthy tongue. Let's explore a few of the unique tongue abnormalities. Blue tongue. It can be caused due to cyanosis, which is lack of oxygen in the blood, methemoglobinemia, abnormal amount of methemoglobin production, which reduces oxygen carrying capacity of the blood. Raynaud's phenomenon, which affects blood flow to certain parts of the body. Vascular issues, which mainly affects the blood vessels. And hemoglobin disorder, which impact the oxygen delivery. So when to visit a doctor for blue tongue? If you notice poor circulation, tingling and purple discoloration in your extremities in addition to your tongue, pain in your mouth, throat or tongue that don't go away, discoloration or spots on your tongue that doesn't change with time, any changes in the texture of your tongue, changes in the size of your tongue. Treatment option for blue tongue includes lifestyle changes. Making small lifestyle changes to improve your circulation, such as avoiding smoking and alcohol, exercising regularly, eating a healthy diet and taking supplements that promote blood flow. And also dietary changes, eating more foods that are rich in folic acid, B12 and iron can help improve your body circulation. Magenta tongue. It can be caused due to not consuming enough meat and fortified cereals and dairy products. It can also be caused due to chronic disorders such as recurrent diarrhea, liver disorders and chronic alcohol use disorder, impaired absorption of food, hemodialysis and peritoneal dialysis procedure that filters the blood, use of barbiturates for a long time are some of the common causes of magenta tongue. Treatment option for magenta tongue includes use of riboflavin or multivitamin supplements, sometimes riboflavin given as IM or IV. As a preventive measure, people who are undergoing hemodialysis or peritoneal dialysis or who have a malabsorption disorder should take riboflavin supplements or a daily multivitamin supplement. People who have riboflavin deficiency are given high dose of riboflavin taken by mouth until symptoms resolve. Scarlet red tongue. Strawberry tongue is the name given to a swollen bumpy tongue. Most often, the enlarged tongue is very red like a strawberry or raspberry. Occasionally, the tongue will be white for a few days before turning red. It can be caused due to allergies, scarlet fever, toxic shock syndrome, and vitamin deficiencies. Treatment options include an antihistamine can treat less serious symptoms of an allergic reaction. For a severe reaction, including anaphylaxis, an injection of epinephrine and intravenous steroids may be necessary. A change in diet may be enough to correct a vitamin deficiency. Eating more foods rich in vitamin B can boost your blood levels of these important nutrients. Toxic shock syndrome requires multiple steps for treatment. An antibiotic fights the infection and another medicine may be necessary to stabilize blood pressure. For scarlet fever, a full course of antibiotic will be necessary. Bald tongue. It is caused due to iron and vitamin B12 deficiency, disease of the immune system such as Sjogren's syndrome and systemic lupus erythematosus. Head and neck radiotherapy. Certain infection caused by bacteria, viruses or fungi including thrush and geographic tongue. Remedies include brushing your teeth twice a day and flossing at least once a day to keep up with your oral hygiene. Stay away from irritants like smoke and other substances. Consume a diet that is well-rounded and contains a variety of foods that are high in vitamin B12 such as meat, fish, eggs and dairy products. Black tongue. It is caused due to poor oral hygiene and a diet of soft foods. Drinking lots of coffee and tea, tobacco use, a heavy alcohol use, certain medications, radiation therapy, dry mouth, some types of mouthwash. Remedies include brushing your teeth 2 times a day using a soft toothbrush and non-abrasive fluoride toothpaste. Floss between your teeth once daily using dental floss or interproximal brushes. Use your toothbrush or a tongue scraper to remove dead skin cells and bacteria from the surface of your tongue. Swish with an alcohol-free antibacterial mouthwash twice a day. Visit your dentist for routine exam and cleaning. If you smoke, try to stop it. Geographic tongue, also known as benign migratory glossitis, is an inflammatory disease that usually appears on the top and sides of the tongue. The cause of geographic tongue is unknown. Several factors have been proposed as possible causes such as emotional stress, psychological factors, habits, allergies, diabetes, and hormonal disturbances. However, none of these factors have been conclusively linked to geographic tongue. Is a treatment necessary for geographic tongue? Geographic tongue usually has no symptoms. In most cases, there is no need for treatment of this condition. Occasionally, geographic tongue may cause a burning or smarting sensation of the tongue. In this situation, topical anesthetics can be used for surface numbing. Fissured tongue. The term fissured tongue describes the finding of multiple small furrows or grooves on the dorsal surface of the tongue. Who can get fissured tongue? Anyone can potentially develop fissured tongue, particularly later in life. Although the cause is unknown, it is not a contagious disease and people cannot pass it to anyone else. Fissured tongue is a harmless condition, usually with no associated symptoms. No treatment is necessary except to encourage good oral hygiene, including brushing the top surface of the tongue to remove any food debris from the fissures. Cleansing of the tongue helps prevent irritation and possible bad breath that may occur from food getting trapped in the grooves. In addition to regular toothbrushes, numerous specific devices to clean the tongue are available at most major pharmacies. Dentists can assist patients by making recommendations concerning devices for tongue cleaning. Thank you for watching.